It should
Great.
start now.
All right, so hello and welcome to the Stony Brook Medicine's Healthy Libraries program. This is a webinar today to discuss disinfection for homeless shelters and food pantries during the COVID-19 pandemic. Next slide. So my name is Mary Ellen LaSala, and I'm the chair of the Undergraduate Department, Nursing Department, the School of Nursing at Stony Brook University. And I'd like to introduce Carol.
Hi, I'm Carol Della, and I'm the Associate Dean for Academic Affairs and Strategic Partnerships in the School of Nursing at Stony Brook University. And we're here today with several students at Stony Brook University who are in the Masters of Public Health program as well as the nursing program. The Healthy Libraries program began as a partnership with the Suffolk Cooperative Library System for students in the health profession schools such as nursing, social work, and Masters of Public Health to provide evidence-based information, screening, some case management, referring patrons to appropriate health and social service programs to really help to support patrons' health and social support needs. And so we were placed in libraries on a regular basis, and now due to the COVID-19 crisis, we're providing information through this webinar. So welcome, and I hope you enjoy the presentation.
So Colleen, before we begin, if you have any questions, we're going to have a question and answer time at the end of the presentation. So we want to talk about the learning objectives first. So today we'll be talking about COVID-19. How does it spread? Who's at risk? What are the signs and symptoms of this virus? How can the spread of the COVID-19 virus be prevented? Personal prevention behaviors. We'll be talking about disinfecting surfaces and how to properly clean your shelter and your area. Guidelines for the shelters and food providers will be discussed, and what are the resources that are available. And we have embedded within this presentation, we have many resources that we would like to share with you. Okay, next slide.
Hi, I'm Sheryl, and I'm a student at Stony Brook University's Accelerated Nursing Program. So what is COVID-19? The coronavirus disease, also known as COVID-19, is an infectious disease caused by a newly discovered strain of coronavirus. The coronaviruses are a large family of viruses that are common in people and many different species of animals, including camels, cattle, cats, and bats. Rarely, animal coronaviruses can infect people and then spread between people, such as that with MERS-CoV and SARS-CoV, and now with this new virus named SARS-CoV-2. All of these viruses have their origins with bats. COVID-19 is a disease process that arises from the SARS-CoV-2 virus strain. Below is a video that goes into further detail explaining COVID-19. This PowerPoint will be posted to the library website after the presentation for your viewing. So who can get sick? Anyone can get sick. It has the ability to affect any age group. There have been cases reported in all 50 states, plus the District of Columbia, Guam, Puerto Rico, the Northern Mariana Islands, and the US Virgin Islands. As of April 16th, the CDC was reporting the total cases in the US were 632,548. They were reporting that there have been a total of 31,071 total deaths in the United States. New York State in particular currently has the most viruses, with 211,550 cases currently being reported. US COVID-19 cases include imported cases from travelers, cases among close contacts of a known cause, and community-acquired cases where the source of the infection is unknown. So this graph is from the CDC, and it reports the rates for hospitalizations due to COVID-19 as of April 4th when it was last updated. It is based on rates per 100,000 people and is separated by age groups. So as you can see, the higher hospitalization rates are for the older adults, 50 and over, with the highest rate of that being 65 and older. As of recently, the New York State hospitalization rates appear to be stabilizing, which is probably mainly due to the social distancing rules that have been put in place. How does it spread? The virus is thought to spread mainly from person to person, between people who are in close contact with one another. They're saying about 6 feet. It could also be spread through respiratory droplets produced when a person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby and possibly even be inhaled into their lungs. Some studies have suggested that the virus may actually be spread by people who are not showing any symptoms at all. It also may be possible that a person can get the virus by touching a surface or an object that has the virus on it and then touching their own mouth, nose, or eyes. The virus is spreading very easily and sustainably between people. Information from the ongoing COVID-19 pandemic suggests that this virus is spreading more efficiently than the influenza, but not as efficiently as measles, which is highly contagious. Symptoms. Reported illnesses have ranged from mild symptoms to severe illness to even death. Symptoms may appear anywhere from 2 to 14 days after exposure. This is an estimate based on the incubation period of the MERS-CoV viruses. Main symptoms include fever, cough, and shortness of breath. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or the inability to arouse, and bluish lips or face, which can indicate cyanosis. If a person is reporting any of these emergency warning signs, they should seek medical attention immediately. Primary prevention. Primary prevention involves cleaning your hands often. Wash hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 70% alcohol. Cover all surfaces of your hand and rub them together until you feel dry. You want to avoid touching your eyes, nose, and mouth with unwashed hands. And you want to avoid close contact with others. You have to remember that people can be asymptomatic and still be able to spread this virus. Social distancing is especially important to those who are at higher risk, so we want to stay home as much as possible. Even if you don't feel sick, you can still spread the virus to other people. You want to cover your coughs and your sneezes. And if you have to cough or sneeze, it should be done into a tissue or into the inside of your elbow. You want to throw used tissues away immediately, and you want to clean and disinfect all surfaces. And below this is a video on how to properly wash your hands that can be viewed after this presentation. So we want to encourage people to wear cloth face coverings, especially when they're out in public, especially if they're going to like the grocery store. These face masks should fit snugly but comfortably against the side of the skin. They should be secured with ties or ear loops. They should include multiple layers of fabric. You want to make sure you can breathe while wearing the mask. Cloth face coverings should not be placed on young children under the age of 2, on anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. This face cover is meant to protect other people in case you are affected, not to protect yourself necessarily. Do not use a face mask that is meant for a healthcare worker. As I'm sure everyone knows, there is a critical shortage of masks, and these masks should be reserved for the healthcare workers who are treating the sick. Even with the mask, you should continue to keep 6 feet between yourself and others. This mask is not a substitute for social distancing. General CDC guidelines on disinfection for businesses. So when cleaning and disinfecting, the CDC recommends wearing disposable gloves. Soap and water should be used to clean surfaces. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use detergent or soap and water prior to disinfection. You want to always follow the instructions provided on the manufacturer's label. You have to keep surfaces wet for a period of time, and you want to make sure to do this in a ventilated area. All disinfectants that are alcohol-based must have at least 70% alcohol. And diluted household bleach can also be used if someone does not have access to disinfectants.
Hi, Colleen. My name is Stacy, and I'm also a nursing student in the Accelerated Nursing Program at Stony Brook University. How to use household bleach. Diluted household bleach can be used in place of disinfectants if appropriate for the surface. You want to make sure that the bleach is not expired. That's very important. And follow your manufacturer's instructions on the container. Do not mix ammonia or any other cleansers together or with the bleach. Leave the solution on the surface for at least 1 minute so that it can effectively kill all microorganisms. And then you want to be sure to completely wipe the surface dry. To make a solution, you can mix 5 tablespoons or 1/3 of a cup of bleach per gallon of water. And a gallon of water, as you know, is 16 cups. Or you can use 4 teaspoons of bleach per quart, and a quart of water is 4 cups. How to clean soft surfaces. So for soft surfaces such as carpets, rugs, and drapes, you want to clean these surfaces also using warm water and soap. Cleaners appropriate for use on these surfaces, which your manufacturer would provide. Launder items if possible, and often if possible, and disinfect with EPA registered household disinfectants, and we'll talk more about that. So for electronics, such as tablets, cell phones, touchscreens, keyboards, remote controls, and even ATM machines, if possible, put a wipeable cover over these electronics. Follow manufacturer's instructions for disinfecting. If no instructions are provided, you can use an alcohol-based wipe or spray, which contains, as Sheryl said, at least 70% alcohol. And then again, you want to dry these surfaces thoroughly. How to clean laundry. For clothing, towels, linens, and other washable items, you should be wearing disposable gloves, and then wash your hands with warm water and soap as soon as you remove the gloves. Make sure not to shake out the laundry, and use the warmest water possible along with your detergent. Also make sure that all of these items are completely dried. Dirty laundry from a sick person can be washed with other items. Clean and disinfect hampers according to guidance for surfaces that we already mentioned. Cleaning and disinfecting the building if someone is sick. So you want to be sure to close off all areas used by the sick person. Open outside doors and/or windows to increase airflow. Wait 24 hours before you clean and disinfect. And then clean and disinfect all areas used by that sick person. If it's been more than 7 days since the sick person visited the building, additional disinfection is not necessary, as it is believed that the virus will then have been killed off just from time. And as always, continue diligence with routine cleaning and disinfection. So when cleaning for businesses, you want to wear disposable gloves and gowns for all tasks while in the cleaning process, including taking out the trash. Personal protective equipment may be required depending on the products used and if there is a risk of your getting splashed. Gloves and gowns should be removed carefully to avoid contamination, and we can speak about that more afterwards. Wash your hands often with warm water and soap for at least 20 seconds. Wash hands immediately after removing your gloves. And if soap and water is not available, a 70% or higher alcohol-based hand sanitizer can be used. But if warm soap and water is available, that should always be your first go-to. Key times to wash your hands. So other times you should wash your hands include, as Sheryl said, after blowing your nose, coughing, or sneezing, after using the restroom as you normally would, before eating or preparing food, after contact with animals or pets, and before and after providing services to your clients. So the EPA has approved common disinfectants to help kill the virus, the COVID virus, or the SARS-2 virus, I should say. The EPA approved common disinfectants and website link we have attached here, and it's pretty comprehensive. And again, we could take a look at that afterwards. So all products on this list meet the EPA's criteria for use against SARS-CoV-2, the virus that causes COVID-19 disease. The easiest way to find a product on this list is to enter the first two sets of its EPA registration number into the search bar. Okay. You can also find this number by looking for the EPA registration number on your product label. If you can't find a product on this list to use against SARS-CoV-2, look at a different product's label to confirm it has an EPA registration number and that human coronavirus is listed as a target pathogen. When using an EPA registered disinfectant, follow the label guidelines for safe, effective use, and make sure to follow the contact time, which is the amount of time the surface should be visibly wet. And then again, as always, after the cleaner has set for that suggested amount of time, you want to make sure to dry the area completely. So these products that we're speaking of also are safe for surfaces. They are not safe for humans, and they are never to be ingested or to be used to clean, say, fruits or vegetables. Some popular brand names include Lysol, Clorox, and Barbicide.
So hi, my name is Talissa. I'm a graduate student in the public health program at Stony Brook University. So I'm going to go over the homeless shelter guidelines by the CDC and the U.S. Department of Housing and Urban Development. So it is important to keep in mind that there is a high likelihood that people with COVID-19 with mild or no symptoms will enter the shelter system. Shelters should not exclude anyone with symptoms unless that is in the pre-designed plan that you have. If you are accepting individuals with symptoms in your shelter, making sure that you have a plan for where they will sleep within the shelter, or knowing where to direct those individuals, like which other location you can direct them to. Shelters may also need to engage in screening for respiratory symptoms, regardless of whether it is COVID-19, and be able to provide masks. So that's something that I'm going to go over in the next slide. And you should also work with partners to increase the capacity for infection control. So making sure that you have an adequate supply of hand sanitizer, having enough hand washing stations, and having enough disinfection supplies. Next slide. So this is how to screen at entry. So the first thing that you want to make sure that you do is to determine if the client has a fever. So you can do this by taking their temperature using a temporal thermometer. So this box to your right, this just explains how to take the client's temperature using this device, what is considered a fever, and also how to clean the thermometer after using it. If you don't have a thermometer, you could also ask the client if they have felt like they had a fever in the past day. And you also want to ask them if they have a new or worsening cough today. So this is a screening tool that will help identify people with symptoms that indicate that they might have a respiratory infection. However, not every person with respiratory infection symptoms has COVID-19, so it's important to keep that in mind. But using this tool that I'm going to keep going over will help to separate those who are more likely to have COVID-19 from the general population. So after you have asked them those two important questions, if the client does have a fever or a new worsening cough, You want to provide them with a face mask to wear over their nose and mouth. That's if you have face masks available. If you don't have any of that available, just advise the client on cough etiquette and provide them with tissues that they can use to cover their nose and mouth. You also want to notify management and appropriate healthcare providers as available. You also want to direct this client to an isolation room if you have that available, or an available space in the area designated for symptomatic persons. As I mentioned before, if your shelter doesn't have an area for symptomatic people, redirect them to another location that does. And also the fourth thing, you want to let your client know that if their symptoms worsen, they should notify someone immediately. They should not be leaving their room or area except to use the restroom. And if they are going to leave the room or the area, they must wear a mask. That's very important. So this is just a continuation on homeless shelter guidelines. You want to limit the number of visitors to your facility. If your facility is full, coordinate with community leaders and other homeless service providers about housing clients. You also want to encourage good hygiene and cleaning and disinfecting surfaces regularly. So it's important that you post educational materials around your facility on things that we mentioned before, so hand hygiene, common symptoms. So there is this link to the CDC fact sheets that they have that you can easily print out and post in your facility. You also want to ensure staff members use disposable gloves when handling client belongings, closing or reducing use of common areas. So you might want to look for other ways to help clients stay connected socially. And another important thing is to identify staff and clients who are at an increased risk for severe illness and decrease face-to-face interactions with others when possible. So this is about preventing spread in homeless shelters. In general sleeping areas, for those who aren't experiencing any symptoms, ensure that the beds and mats are at least 3 feet apart, and also ask clients to sleep head to toe. You want to provide access to fluids, tissues, plastic bags for disposal of tissues. Also ensuring that bathrooms and sinks are constantly stocked with soap and drying materials for hand washing. And as we mentioned before, provide at least 70% alcohol-based hand sanitizer, especially at key points within the facility, so entrances and exits, eating areas, and registration desks. Also, as mentioned previously, providing masks at check-in for any client that shows symptoms. And as of today, actually, New York State is recommending that everyone wears a cloth mask, not just those that are presenting symptoms. You also want to monitor clients at high risk for complications. And as mentioned before, it's really important to emphasize to confine clients that do show symptoms to individual rooms and have them avoid common areas. So this is just a guidelines for those that are showing symptoms. So you want to make sure that the beds are actually at least 6 feet apart. In this case, use temporary barriers such as curtains between clients. Acts, as I mentioned before, for them to sleep head to toe. And as mentioned before, consider reducing the cleaning frequency in bedrooms and bathrooms to protect the staff from potential exposure. If a client does have severe symptoms that are consistent with COVID-19, arrange for the client to seek immediate medical care. And please do notify the medical transfer team and the medical facility of possible COVID-19 infection. And very, very important to please clean and disinfect the facility after a confirmed case of COVID-19. So these are guidelines for handling food in shelters. So while serving food, provide hand washing facilities and alcohol hand gel at the beginning of food service lines. If possible, ensure that food is served to guests, not having them self-serve. Ensure that the plate is not handled by a guest till the end of the line. Do not pass plates back and forth between the guest and the server. Ensure plates are not used for second serving. Have staff handle tray and utensils. Serve food in individual proportions rather than shared family style. Also, wearing disposable gloves when serving food, and thoroughly and continuously disinfecting the facility and food areas. So these are kind of a continuation of the previous slide. These are guidelines for preparing food in shelters. So food handlers should thoroughly wash their hands and arms with clean soap and water for at least 20 seconds. Thoroughly rinse with clean running water and properly dry your hands. Ensure that there are hand washing signs posted in appropriate locations and in different languages. Provide hand washing facilities as emphasized. Food handlers should wash with soap and water before they work, before returning to work from using the bathroom or other activities that contaminate their hands. And food handlers should change their gloves anytime they touch soiled or non-food handling items, such as the floor, their face, or any dirty dishes, or anything like that. So this is just a sample list of recommended supplies to keep available. This is from the U.S. Department of Housing and Urban Development. So these are kind of things that we kind of already touched on, but it's important to keep disinfectant products, dividers. So we mentioned curtains before. If you don't have curtains, perhaps using sheets. Instead, having extra fluids and food, having medications to bring the fever down. As I mentioned before, thermometers and cleaning supplies. It's very important. So this is just a screenshot. It's not the complete list, but this is a general sanitation checklist for shelters. It's also from the U.S. Department of Housing and Urban Development. So as I said, it's not a complete list, but it is something you should consider using. There were other items on the list, such as, disposing of contents of waste containers, observe shelter clients for signs and symptoms, keeping a daily roster, and bed maps of shelter clients. So those are other things on the list, so you might want to consider taking a look at that. So now we're going to be talking about the food pantry guidelines. So we took this information from the Pennsylvania Department of Agriculture Bureau of Food Assistance that we thought would be useful for us. So as emphasized many times before, wash your hands with soap and water for at least 20 seconds. If soap and water aren't available, using alcohol-based sanitizer is very important. Encourage cleaning of frequently used objects, such as counter spaces, shared pens, volunteer check-in stations, handles on carts if you are using grocery carts, bathroom door handles, and doorknobs. You also want to practice and reorganize your space to promote social distancing. So as we mentioned before, at least 6 feet of distance between people. So you might want to consider placing tape on the floor that designates the 6 feet distance. That might be helpful. You also want to sanitize hourly or more frequently as needed. If you request sick clients to stay at home, please let them know how to still receive food For example, perhaps implementing a proxy system that allows a friend or a family member to pick up their food packages. You also want to consider alternate delivery systems. So perhaps having a drive-through distribution or distributing prepackaged bags at a food program door. And if you have sanitizer available, ask clients to use it as soon as they come into the food pantry. So just continuing on the food pantry guidelines, if possible, request clients to wash or sanitize their hands before selecting their food, or to wear disposable gloves if they have available. Also, pre-bag produce. You also want to consider keeping the amount of food on display low and restock more frequently to reduce the amount of food touched by different clients. Instead of making food available for clients to browse, consider a menu-only option with volunteers taking orders from clients and packing bags for them. You also want to limit the number of people in the food pantry space to reduce congestion. So consider extending your hours or open for an additional day. If your program has an appointment system, admit fewer people for each appointment and add additional appointment times. You also want, if possible, to increase home delivery if you're able to do that. Temporarily postpone any food demos or cooking classes that you might have had, and don't offer any food samples. You also want to remove or limit access to chairs, papers such as books or recipes, bathrooms, or other things that are usually made available to clients. So this is just a list of video resources on disinfecting food supplies that we made. We also, the last 2 bullet points, these are just articles. So one is a medically reviewed article, guiding a guide for handling groceries and takeout. And then the other article is on healthy eating tips during this time. We also have additional community resources, sorry. So we do have like different hotlines here mentioned, such as the National Domestic Violence Hotline, child abuse. What else do we have? We also have other resources on our other slides. So mental health resources, such as different hotlines that you can use. We have food assistant resources mentioned, such as Island Harvest, and on WIC and SNAP. And we also have financial assistance and housing resources if needed. I don't know if we have any other resources now. I think that's it.
Okay, well, thank you very much, all the students, for such great information. I see that, Tony, you have joined us. And Tony, where are you from?
Hi, I'm from Patchogue-Medford Community Services. We have a food pantry
Oh, great. Thanks for
on
joining.
390 Bay Avenue.
Wonderful, wonderful. Now, I'd like to open it up to questions. Do you have any questions, Tony or Colleen?
No, not at this time. It's a very thorough presentation. Thank you.
Oh, you're very welcome. The students did a great job.
Yes.
I also wanted to mention for the videos on package handling, which I have here. And if you go to the video links, even though they're for, I don't know if my computer is going to load, even though they're for general, like bringing home groceries, they might be helpful for people getting food from the food pantry to know how to disinfect the packages that they're taking home from the food pantries. So they might be useful, as well as disinfecting mail or packages, pizza boxes, that sort of thing.
Great.
Tony, may I ask you a question?
Tony?
Sorry, I was having a problem unmuting.
Okay.
Yes,
I
what-
So I was just wondering, are you seeing a larger number of people coming now?
Unfortunately, no, we're not. We're open Tuesdays and Thursdays. We usually typically were Monday and Thursday. Monday was always our slower day. We usually see about 20 families on a Thursday.
Mhm.
What did I have last Thursday? I had about 13. So no, I think people are afraid to come out.
Yeah, that makes sense. And the distribution as far as the food goes, that's staying consistent?
Yes, we're whoever we're giving it out to, we're loading them up, and I'm also getting some phone calls. We do deliver to some of the homes. So I've had a couple of that this week. So we did deliver to the doors of clients.
Excellent.
Thank
Thank you.
You're welcome.
Okay. Any other questions or any comments?
Oh, you guys did a great job. I can't imagine what an undertaking this must have been for you all to coordinate and put this together. It was very good, very good.
Okay. Thank you. Thank you very much. Wonderful Stony Brook students. Okay, so if there's no other questions or comments, I guess we could sign off.
Nice
Thank
job,
you.
everyone.
Stay well. Bye-bye.
Everybody
Thank you
stay
so much.
well. Thank you.
Thank you, everybody.
Thank you.